Hi, I'm Randy Alvarez. You're watching the Randy Alvarez Health Report. With us, we have Dr. Bajaj, and he is a pain management specialist out of LA. He works with, getting people out of pain, helping them avoid surgeries, whether it's knee pain or any type of joint pain, shoulder pain, tendonitis, neuropathy. This is what he does. Specifically, what I invite him on the show today to talk about is PRP, using PRP, Platelet Rich Plasma, shooting it into the area and healing the area, and people are apparently getting great results. Okay, so welcome to the program.
Thank you.
Now, for people that don't know you, a little bit about, you went to UCSD. Tell me a little bit about your training.
Sure, I went to UCSD as an undergrad. Then I migrated over to the East Coast, New York Medical College for medical school, and simultaneously an MPH as well.
MPH is what? That's public health?
That's a master's in public health. That's
is that
right.
For the business of medicine? Is that why you would do that?
Yeah, it's important to have kind of a comprehensive approach and an understanding, more importantly.
So how long were you in school, by the way?
That was just 4 years.
But I mean, total
simultaneously.
school? Oh, same time. Okay,
yeah,
good for you.
Yeah, but I mean, that being said, you throw residency and internship and fellowship into it.
Like 12 or
We're
14
looking
years?
At, I wish, more like 15.
15 years.
Mm-hmm.
Well, good for you. Okay, so and then you decided to get involved in, I guess you were anesthesiologist, board certified anesthesiologist.
Correct.
And then you did a pain fellowship.
I did.
Which is?
So I did that at UC San Francisco.
Okay.
And the reason that I did that is because, pain management is a field that's growing very, very quickly. And it's a field that's also undertreated and somewhat not understood as well as it could be. So I want to help bring recognition to these patients that need chronic and acute pain management.
Okay, so let's jump into PRP. I know you work with basketball players, professional basketball players.
I do.
Getting people back on the court. Okay, but PRP, for people that don't understand what it is, what is it, and how does it work when you inject it into the knee or the shoulder or the tennis elbow or whatever? What's happening?
So PRP stands for Platelet Rich Plasma. And in essence, what we're doing is we're taking your own blood, we're extracting the platelets only out of that blood, which is the active ingredient in healing, we'll call it.
These are red blood cells or white blood cells?
Well, this is platelets or white blood cells?
Oh, the platelets. Platelets are what? Form a scab?
That's right. So platelets have multiple different functions. The one that we all know is they help clot your blood. So if you cut yourself, you stop bleeding, that's because of platelets.
The platelets.
That's right.
Okay.
But what they also do is release growth factors that help healing. That's what we're taking advantage of with PRP.
That means they draw growth factors from the body to those
that
platelets?
means they actually release growth factors.
They release growth factors.
That's right.
Interesting.
That's right.
Okay, good.
And so that's what we're taking advantage of with PRP.
All right. So if somebody comes in, and let's say they have a knee problem, you catch them early. What is the problem normally? Like, what's a typical knee problem that's coming on early on? I guess by the time they go to the doctor, they're in trouble. That means they put up with it, they've iced it, they've wrapped it, they wear those things around it, but now they can't take it anymore. Right?
Yeah, so I make the assumption if somebody's gone out of their way to see a doctor like me, and typically you'll take 5 to 6 different doctors before you can see somebody like me, they're clearly in pain for some reason. Now, if that's the case, then typically what's going on is either early onset or late onset degenerative joint disease, aka arthritis.
Okay.
Now, what is arthritis? Arthritis, in essence, is an inflammation of the joints, typically because the cartilage is being diminished, and that bone-on-bone phenomenon, which we've all heard of that term, is just causing extreme inflammation and pain.
So the bones rubbing together are causing the pain?
In essence.
Okay.
In essence.
And when you inject PRP, what's happening?
So now
you're growing back cartilage?
So potentially, here's the thing with PRP, is what we can definitely say is we're maintaining the amount of cartilage that is there. There are some very new studies and very new data coming out now that actually are showing a potential regrowth of cartilage. But I think it's too early to tell. The jury's still out on that one.
Well, tell me this. Okay, so somebody goes to you and their knee hurts, right? You inject PRP, couple of treatments, one treatment?
Depends on the patient.
So let's say 2 treatments. Have you ever had somebody that has knee pain, you do the PRP, and their pain goes away? And they're back to function?
So here's what I will tell you.
Has that happened?
Yes.
With you?
More often than not.
Like what, once a week?
No. So PRP is something we want to do once a month.
But I mean, how often do you see patients getting better?
Here's what I would say. I would say the majority of my patients get better after 1 to 2 treatments than not.
Okay.
And I cannot say that, frankly, with other modalities that I use.
So I'm trying to get the numbers. I mean, every single week in your practice, you see people that may call you and say, my knee's fine.
Oh, yes.
Is that right?
Absolutely.
And so if the bones aren't rubbing together anymore, is that what's happening?
No.
Something has to be rebuilding in there.
So something is rebuilding.
I mean, that's the part I'm having a tough time understanding. What's going on that is relieving the pain? Is it just an anti-inflammatory?
It's not, and that's
Okay.
what really separates PRP from your typical cortisone injection.
Okay.
So a cortisone injection, I can get that same phone call from a patient saying, hey, I feel great a week later, but I'm going to get another phone call 4 weeks later saying, it's back. What do I do? So we're really limited with how many cortisone or steroid injections we can perform because of a host of different side effects. But here's the thing with PRP. Data now shows a year out, these patients are still experiencing relief.
And the relief is coming from where, though?
The relief is coming from a decrease in the inflammation because of what the platelets are doing in that
All
joint.
right. All right.
Yeah.
Okay. And what else? And you say there's a study that out of where?
There's a study in Santa Monica looking at specifically at knee pain, which shows a thickening of the cartilage in knees. There's a second study out of Stanford showing in epicondylitis or tennis elbow or golf elbow, 93% patient satisfaction from a pain standpoint 1 year out.
Interesting.
That is
So
interesting.
you know, like everything in medicine, I don't pretend to know what you know, but it seems like, you know, I've interviewed thousands of doctors.
Sure.
But that everything is catching it early. So let's say early onset tennis elbow.
Okay.
I play tennis. I don't have tennis elbow. But early onset, if you can get that person, are you convinced, again, it may not be supported in the literature, but are you convinced if you catch it early enough, you know, keeping in mind that, you know, diet, nutrition, exercise, lifestyle, is that an easy one for you to fix with PRP?
Yes, I can confidently say yes to you.
Like reverse it. When I say treat it, that's one thing, but do you think you can fix it where it doesn't hurt anymore?
You know, yes, I do. I do
good.
think so. And I'll tell you this, if it was me and I had to go in for a treatment and I had an option of cortisone, medication management, acupuncture, et cetera, et cetera, et cetera, 100% I would choose PRP for myself.
Are you getting the tennis players in there? Or is it
We're-
most of the knee people?
No, we're getting all joints. I see tons of tennis players. I see a lot of golfers, lots of basketball players, lots of runners, anything that's causing any sort of impact or repetitive motion on a joint.
Any miracle stories? People that say, oh, doc, this is the best thing ever?
I had one patient who was scheduled to have back surgery, spinal surgery, because of a degenerated disc. So again, this is not a joint, and this is very novel. And what we did is PRP in that particular disc, and we were able to mitigate this patient's pain to the point where she's prolonged surgery. Can't say how long it's going to last. This is very new, but that's definitely a
treatments?
success. 3.
So you think that's then the future of pain management is going to be utilizing PRP?
The future of pain management is biological medicine, right?
Okay.
If we have the ability to regenerate whatever's causing the pain, why not do that versus masking the symptoms?
Are there stem cells in there?
Not with PRP, but it's along the same line.
Okay, so you love PRP. Any misinformation out there about PRP?
You know, lots of people really question PRP's validity. Is it FDA regulated, et cetera, et cetera? And what I can say to those folks is, yeah, it is FDA approved. And like I said, just more and more information is coming out to show its validity.
You take insurance. Does it cover the PRP treatment?
No, you know, it's such a new treatment in the U.S. that insurance typically does not cover it.
How much could somebody expect to pay for a prolotherapy treatment? I'm sorry.
PRP?
PRP treatment.
Yeah, a typical PRP can range anywhere from $800 to $900 to maybe $2,000.
Okay. And but when you say 2,000, is that multiple treatments?
Multiple treatments, multiple sites.
Because you're doing it in the OR, under scope,
Yep. So
directly into the area.
that's right. That's right. So there's no guesswork, there's no ambiguity. But here, let me pose this to you. If we have somebody coming in who has knee pain, but they also are now compensating because of the way their knee pain, they've changed the way they walk. Now they've developed hip pain. They've chosen not to do anything about it for 5 years. Now you have somebody coming in who may potentially benefit from hip and knee PRP. So that may kind of vary the out-of-pocket cost for that person.
Okay, the results. And so how many of these are you doing a week? At least
You know-
one or two a week?
Oh, no, much more than that. We're probably doing, I'd say, 1 to 2 a day.
Is that right?
That is.
And are they mostly knees, shoulders? What are they? Tennis elbows?
You know, we're really seeing everything. I'm seeing carpal tunnel. So we're doing wrists, we're doing elbows, both medial and lateral, golf and tennis elbow, hips, knees, ankles.
Have you ever had a 100% reversal of carpal tunnel yet?
Not yet.
Have you had, I guess there's what, pain numbers like 10 to a 5 to a 4? Do you have people that go from, you know, like a 10 to a 5?
Oh, we have people going from a 10 to a 0.
Okay.
Right.
But isn't that 100% then?
Yeah, it is, but I can't necessarily say that we've regenerated the cartilage, for example.
But you've had it go away. That means you've had people that come in with carpal tunnel and their carpal tunnel after a few treatments is gone.
Yes.
That's not an exaggeration.
That is not an exaggeration.
And how common is that, by the way?
50%.
And why aren't they talking about this, by the way?
It's
I don't
so
see
new.
this on the news.
Well, it's so new.
Seems
It's
like a
such
press
a new
conference,
therapy.
right?
It's such a new therapy.
And so but you're getting big results. And in your mind, what is the biggest untapped market? I mean, what type of sports injuries, people that really need this the most and need to be exposed to this the most?
I really think it's a matter of physician education as well as patient education. And what I mean by that is, look, if you go in to see your doctor because you have knee pain, the knee-jerk reflex, no pun intended, shouldn't necessarily be to have a cortisone injection. It should be to consider something like this first and foremost. And that's really physician education.
I want to thank you for coming on the show. Very nice. I have one
Thank you.
PRP story. A friend of mine, close friend, was scheduled for shoulder surgery. I think I told you this on the phone. And I said, you know what, maybe you need to see somebody that does prolotherapy. Because I, at that point, which was 2 months ago,
Right.
didn't even know they were injecting PRP in
Right.
there. Or maybe I knew, but I didn't know anybody that was doing it.
Sure.
And so she goes to this prolotherapy doctor. And then she calls me and says, well, he also is doing this thing called PRP. So he's doing PRP and prolotherapy. Okay, so she was scheduled. It was literally like I was talking to her on the 5th, and on the 27th she was scheduled for surgery. And from my understanding, because I'm calling all my buddies, they say shoulders surgeries don't usually come out that well. There's a lot of problems.
Yeah.
She's, I think, had 3 treatments, no more surgery, no more pain. She couldn't even sleep because of it. Now she feels great.
Isn't that amazing?
And that's my one story.
Well, that happens, I would say, every week in our office.
How come you didn't bring that up until right now? Is that a top secret? Is that why?
The secret's out.
No, I like the fact that you're an evidence-based guy. That means you're quoting studies and you're careful not to exaggerate. But for some people, it works really well. But would you say I mean, obviously, the earlier they get to you, the better the
Absolutely.
results.
Early treatment is extremely important,
And
better
that's the
prognosis.
problem, right? I mean, everybody, especially guys, we wait until we can't walk, we
Right.
can't play golf. I mean,
Right.
until it's at the end.
It's almost too late, right?
So if you get them early, a couple shots with PRP.
So, and now they've avoided exposure to all these other medications. They're better, and their quality of life goes through the roof.
All right. I want to thank you for coming on the show. Very interesting. Good
Thank
stuff.
you. Thanks for having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or send it to a friend or post it on Facebook, just go to my website at wellnesshour.com and put in Dr. Bajaj. For now, I wish you good health.